Bismillah ar-Rahman ar-Rahim, my dear Vascular colleague. It's very important to know which congress for you to attend and which society to follow up. One of the very important society for vascular surgery is the European Society of Vascular Medicine. And here is a very nice lecture about introduction to the society and introduction to the Congress, which usually happen once every year. And this presentation or introduction will be by Professor Lucia Mazziali. She is the president of the European Society of Vascular Medicine. I hope you all enjoy it, and I hope you all join the society, which is free to join.
And good evening to everybody. And I'm happy to share this afternoon with my distinguished colleagues. So the idea now is to say a few words about who we are, what ESVM is, and why you should join us in Milan. And I would like to start with sharing my screen, and I have just a few slides to show you, and so it's gonna be easier for everybody. And the idea really is to say, why do we need to speak about vascular medicine? Why do we care? We care for many reasons, because the burden of vascular diseases is very high, it's underestimated, and it's growing worldwide because the population ages. And just to make an example, if we speak about arteries, peripheral arterial diseases, it touches 1 out of 5 people above 65 years of age. And these people have a very significantly increased cardiovascular risk. Pulmonary embolism is still number 1 hospital cause of death, and 1 out of 1,000 people will be diagnosed with venous thromboembolism. 1 out of 3 men will suffer from venous insufficiency, 1 out of 2 women. 1% of the adult population will have a vascular ulcer. And 16% of patients with cancer will suffer from lymphedema. So you see how vascular diseases really touch a lot of people, much more than what we actually think. And for that, we need to have a holistic and a comprehensive approach to vascular patients. And this is the reason why we need vascular physicians. And these are highly trained and dedicated physicians that are experienced and specialized on vascular science and vascular diseases. But especially, there is a holistic and comprehensive approach to vascular patients, and the capacity to work in network with other specialists to take care of all these vascular patients that are very heterogeneous. But so a few years ago, particularly in 2014, because of the need of vascular medicine, the European Society of Vascular Medicine was created. And this is an independent nonprofit organization, and it's composed of society members, which are the National Society of Vascular Medicine in those European countries that exist, and also vascular groups from those European countries where still we do not have a vascular medicine or angiology specialty. We have now 19 European national societies that joined the European Society of Vascular Medicine. And our mission is to reduce the burden of vascular diseases. And you have seen how much those are important. So you will hear from the distinguished speakers of today as well. The idea is to promote scientific exchange, education, research, and very good evidence-based, high-quality practice guidelines in the field of vascular medicine. The idea is also to strengthen the links between the national societies and to encourage the creation of national societies in those countries where it does not exist. And overall, to promote vascular medicine, because this is going to be one of the health burden of the future. So we get together once in a year for European Society of Vascular Medicine Annual Congress. And this year is going to take place in Milan between the 12th and the 14th of October. And this is where all the vascular specialists join forces and discuss together. Indeed, we face many challenges, and the burden of vascular diseases is growing worldwide, as you saw, and we need to really get together, and there is really the need of a call to action. ESVM 2023 is the place where vascular physicians and researchers get together to share their knowledge and experience and to construct collaboration and exchanges. The scientific committee has gathered renowned speakers, and we will discuss a variety of topics, and I'll show you the preview of the program just in a while, we're going to touch on peripheral artery diseases, venous insufficiency, the rare vascular diseases, lymphedema, and also we will cover the full spectrum of vascular intervention as well as preventive vascular medicine. The idea is to offer the best possible education experience to all the participants. We understand that we have to work together in network, and that's why other societies will join us during this Congress, the Society of Vascular Medicine from the United States and the European Society of Atherosclerosis, the International Union of Angiology, and the European Society of Cardiology. And as I told you, national societies are extremely important. And this year, we will welcome two national societies, invited national societies. This is the French Society of Vascular Medicine and the Italian Society of Angiology. The beautiful city of Milan will be the perfect setting for this scientific event. And we really hope that you will join in Milan, and we encourage you to make plans to be with us. So this is the beautiful setting where the Congress will take place over 2.5 days. Our first day on Thursday, you can see that you can touch on carotid arteries. We will have an update on diabetes and microcirculation, of course, venous diseases, some basic science, and peripheral arterial diseases. We will have keynote speakers that will talk to us about vascular diseases and gender and sex. And the second day, we have a breakfast with experts to really discuss what are the unmet needs in peripheral artery disease patients. We will touch on critical limb ischemia, lymphedema, lymphatics, lipedema, and we will have some best abstract communication, our free communication sessions. And we will take care also of the cardiovascular risk in our vascular patients. And finally, we're going to speak about antithrombotics in vascular diseases and venous thromboembolism. And our young vascular physicians have prepared 2 sessions on rare vascular diseases and malformations. So once again, I hope you will join us in Milan, and I'm looking forward to the next presentations from my colleagues.